Hello and welcome back to Medical Minds, where we explore critical health topics backed by science. Today we are delving into an alarming concern that many pregnant women may not be aware of: the consumption of high fat and sugary diet during pregnancy and how it can raise future health risks to babies. The recent research has highlighted the long-term impacts that maternal nutrition has on the health and development of the fetus. The choices made during pregnancy don't just affect the mother, they have profound consequences for baby's future health. In this video, we will discuss these risks, explore the latest scientific findings, and provide evidence-based recommendations for healthier pregnancy nutrition. The period of pregnancy, also known as gestational period, is critical for fetal development. The nutrients the mother consumes directly influence the baby's growth, organ formation, and metabolic programming. A high-fat and sugary diet can disrupt these essential processes, leading to several adverse health outcomes that may not manifest until later in the child's life. Research from the British Medical Journal in 2023 indicates that excessive intake of high sugar and high-fat foods during pregnancy can increase the likelihood of metabolic syndromes in child. These include obesity, type 2 diabetes mellitus, cardiovascular diseases, and other chronic conditions. Why is a high-fat and sugary diet so harmful? Let's dive into the science. Number 1 is maternal obesity and insulin resistance. A high-fat diet during pregnancy often leads to maternal obesity and insulin resistance. When the mother's body becomes resistant to insulin, it results in elevated glucose levels that pass through the placenta, leading to fetal hyperinsulinemia. This excess insulin production in the fetus increases fat storage and primes the baby for obesity later in life. Second is epigenetic programming. Recent studies, including research from the National Institute of Health, have shown that poor maternal nutrition can lead to epigenetic changes in the fetus. This means that the genes regulating metabolism and fat storage are modified, increasing the child's susceptibility to obesity, cardiovascular diseases, and non-alcoholic fatty liver disease. Third is increased risk of gestational diabetes. High sugar consumption raises the mother's risk of developing gestational diabetes mellitus. Gestational diabetes mellitus not only affects mother but also increases the chances of baby developing obesity and type 2 diabetes as they grow older. A study published in the Lancet Diabetes and Endocrinology in 2022 emphasizes the strong correlation between gestational diabetes and metabolic disorders in offspring. The health implications for children born to mothers who consume high fat and sugary diet are significant. Here is a breakdown of most concerning future health risks. Top of the list is childhood obesity. A high-fat and high-sugar maternal diet has been directly linked to increased fat deposition in newborns, predisposing them to childhood obesity. In 2021, a study from the Journal of Pediatrics found that children born to mothers with a high caloric intake of fats and sugar during pregnancy were 3 times more likely to develop obesity by the age of 5. Second is cardiovascular disease. Poor maternal diet can alter the baby's lipid metabolism, increasing the risk of atherosclerosis and cardiovascular disease. A groundbreaking 2023 study in the European Heart Journal found that children of mothers with high saturated fats consumption had elevated cholesterol levels and higher rates of heart disease in early adulthood. Moreover, a high-fat diet causes low thyroid activity and lower thyroid hormone. This hormone helps the fetal heart to prepare for life after birth. Without it, the heart develops abnormally. Next is type 2 diabetes. The fetal programming hypothesis suggests that high glucose exposure in the womb predisposes the fetus to insulin resistance. As a result, children may develop type 2 diabetes mellitus at a younger age. A 2022 study in the Journal of Maternal, Fetal and Neonatal Medicine confirmed this, highlighting that maternal sugar intake was a significant predictor of type 2 diabetes risk in offspring. Last is cognitive development issues. High sugar consumption, particularly from fructose, has been linked to impaired neurodevelopment in children. A 2022 report in the American Journal of Clinical Nutrition found that excessive fructose intake during pregnancy was associated with poor cognitive performance in children at the age of 7, especially in areas of learning and memory. Now that we understand the potential risks, let's focus on how to mitigate these issues through proper maternal nutrition. Balance is key. Pregnant women should aim for a balanced diet rich in complex carbohydrates, lean proteins, healthy fats, and an abundance of vitamins and minerals. Foods such as leafy greens, whole grains, nuts, seeds, lean meats, and fish are excellent sources of essential nutrients. limit sugars and processed foods. Reducing the intake of added sugar, sugar beverages, and processed foods high in unhealthy fats is crucial. A systematic review in Nutrients 2022 showed that the women who adhered to a diet rich in whole, unprocessed foods had better pregnancy outcomes, including lower rates of gestational diabetes and healthier birth weight. Increased fiber and antioxidants. A diet rich in dietary fiber can help manage blood sugar levels and prevent excessive weight gain during pregnancy. Additionally, consuming antioxidants, especially from fruits and vegetables, can reduce oxidative stress in both the mother and fetus, promoting better fetal development. Omega-3 fatty acids. Incorporating omega-3 fatty acids found in fatty fish like salmon and flax seeds into the maternal diet is linked to healthier brain and eye development in babies. A 2023 meta-analysis in obstetrics and gynecology showed that omega-3 supplementation reduced the risk of preterm birth and enhanced fetal brain development. In summary, a high-fat and sugary diet during pregnancy can lead to long-term health risks for the child, including obesity, cardiovascular diseases, type 2 diabetes, and cognitive issues. The emerging body of research highlights how crucial maternal nutrition is during pregnancy. By opting for a balanced, nutrient-dense diet, mothers can help safeguard their babies from future health challenges. By ensuring pregnant women are aware of the risk of high-fat and sugary diets, we can contribute to healthier future generations. If you are pregnant or planning to conceive, it's essential to consult with a healthcare provider or nutritionist to ensure you are making the best choices for both you and your baby. Stay informed and make empowered decisions. Thank you for watching Medical Minds. Don't forget to like, share, and subscribe to our channel for more health insights.